Do you feel tired, sleepy during the day? It could be sleep apnea. Hi, I'm Dr. Bassel Chaykhouny, ENT specialist, French board certified from the University of Henri Poincaré, France since 1994 with 31 years of experience. Happy to announce that I recently joined the Marina branch of Emirates Hospital Group, where we can treat our patients for all ENT conditions like otitis, vertigo, imbalance disorder, tinnitus, all kinds of hearing loss, headache, migraine, sinusitis, allergic rhinitis, all salivary gland and thyroid disorder, with special interest in snoring and sleep apnea. Snoring is a common symptom, especially in Dubai, due to the lifestyle, and it's abnormal, annoying sound during a sleep caused by airway obstruction. It affects male more than the female. Several factors contribute to increase it, like overweight, family history, anomalies of the mouth and the sinuses, deviated nasal septum, enlargement of inferior turbinate, kissing tonsils, enlargement of adenoids, and enlargement of base of the tongue. When we should be worried? In 10% of loud snoring, when it's coupled by stopping breathing and long pauses, it may indicate sleep apnea, which may lead to serious problems like hypertension, heart disease, stroke, decreased memory and concentration, ground fatigue, and depression. What we can do about it? By changing the lifestyle, reducing the weight, sleeping on the side, using some nasal spray, and if symptoms persist, it's very important to see an ENT doctor. The ENT specialist will do full evaluation of the situation and will prescribe the needed treatment from oral device till appropriate surgery. Message to take home: don't ignore it. Early diagnosis prevents a major complication. Better sleep means better health. Thank you.